Medicare and Medicaid Fraud, Waste, and Abuse Training. Legal Notice and Disclaimer. Course Description. This course provides information about fraud, waste, and abuse in the healthcare industry as it applies to the Centers for Medicare and Medicaid Services, identifies your responsibility as a person, and the applicable laws and regulations and how to abide by them. Length is about 1.5 hours. Learning Objectives. Table of Contents. Who is required to take fraud, waste, and abuse training? With the increased number of federal cases on medical fraud and abuse, the Centers for Medicare and Medicaid Services, CMS, has rendered the fraud, waste, and abuse training compulsory. This is required for all Part C and D first-tier downstream related and delegated entities, including Medicare Advantage providers who administer the Part D drug benefit or provide healthcare services to Medicare Advantage enrollees. Regulations effective June 7, 2010 implemented a deeming exception that exempts FDRs enrolled or participating in Medicare Parts A or B from annual fraud, waste, and abuse training and education. Therefore, if a provider is enrolled or participating in Medicare Parts A or B, the fraud, waste, and abuse training and education requirement has already been satisfied. If you are unsure if this deeming exception applies to you, please contact your plan sponsor for more information. Examples of entities who are required to take fraud, waste, and abuse training include pharmacy benefit managers, PBMs, pharmacies and pharmacists, subcontractors, for example, claims processing firms, dentists, network providers, hospitals, primary care providers, ancillary providers, specialists, IPAs, and medical groups. Get ready. You are now ready to start the course. Press the Start Lesson 1 button below to begin your first lesson. Lesson 1. Introduction to Fraud, Waste, and Abuse. The United States is among the wealthiest nations in the world, but it is far from the healthiest. Although Americans' life expectancy and health have improved over the past century, these gains have lagged behind those in other high-income countries. This health disadvantage prevails even though the United States spends far more per person on healthcare than any other nation. The U.S. healthcare system. When a person becomes ill, they have to engage the healthcare system. Depending on the illness, they may need goods, medicine, equipment like crutches or a cast, and services, medical skills, services, and time from a healthcare provider. A healthcare provider is a health practitioner who will attempt to help bring them back to optimal health. This can be a medical doctor, a registered nurse, a dentist, a chiropractor, or even a physiotherapist. Payment for these goods and services are usually made through health insurance that will pay part or all of the costs incurred. The U.S. healthcare system relies on two types of funding sources: private funding and public funding. The private component is funded by individuals or their employers, while the public component is funded by the government through the taxes collected from its people. The public component is managed by the Centers for Medicare and Medicaid Services, CMS. There are two important programs that the CMS administers. Medicare is a federally funded health insurance program for people 65 years of age or older. Medicaid is a federally and state-funded health program which provides government insurance for people of any age whose incomes are insufficient to pay for health care. Medicare Parts. Medicare, the insurance program for people 65 years of age or older, consists of 4 different parts that pay for various services. Original Medicare, administered by CMS. Medicare Part A, hospital insurance. Examples: hospital stays, skilled nursing facility, home health, hospice care, etc. Medicare Part B, medical insurance. Examples: doctor visits, durable medical equipment, laboratory tests, x-rays, mental health, ambulance services, etc. Extended Medicare, private companies contracted with CMS. Medicare Part C, Parts A and B through private health insurance. Note, Medicare Advantage plans must offer at least the same benefits as original Medicare, those covered under Parts A and B, but can do so with different rules, costs, and coverage restrictions. Medicare Part D, prescription drug insurance. Note, Part D is provided only through private insurance companies that have contracts with the CMS. By 2017, U.S. healthcare spending is projected to reach $4.3 trillion and comprise 19.5% of GDP. That means by 2017, 20 out of every $100 spent in the United States will be on healthcare. What does this mean? It means that the U.S. government funds allocated toward healthcare is massive, to say the least. This huge amount of money attracts people who want to gain access to these funds illegally or misuse them. The big problem. According to 2011 estimates, the United States of America has lost from 3 to 10% or $82 to $272 billion annually due to healthcare fraud and abuse. A variety of fraud and abuse schemes have come into play, such as charging for non-existent home visits to give insulin injections, overbilling for services, repackaging expired drugs and selling them off as fresh ones, stealing medical patient identities to gain access to controlled drugs. The value of human life has taken a back seat to greed. The U.S. government has taken a strong stand against fraud, waste, and abuse in the healthcare system via the Affordable Act, aka Obamacare, and significantly amended existing anti-fraud statutes. These provisions established fundamental expectations for compliance, disclosure, transparency, and quality of care by healthcare providers. You'll learn more about how these changes are helping in a later lesson. One of the major changes to the healthcare system to help combat fraud, waste, and abuse has been the transition from fee-for-service, FFS, to value-based purchasing, VBP. Healthcare reimbursements were previously done through a system called fee-for-service, FFS. This means the healthcare provider billed Medicare or Medicaid for the service that was rendered. A lot of fraud, waste, and abuse cases stemmed from this system. To combat this, healthcare providers are now transitioning to a value-based purchasing, VBP, system that focuses on quality patient care. This program enhances a healthcare provider's effectiveness in providing care by measuring their performance based on a set of identified metrics. An added benefit of this system is that it is estimated to extend the life of Medicare's trust fund by another 13 years, for example, up to 2030. The following agencies have been collaborating to combat and reduce fraud, waste, and abuse in the U.S. Medicare and Medicaid healthcare system. To understand what they are up against, let's look at some examples of fraud, waste, and abuse in the healthcare system. Fraud is defined as an intentional act of deception, misrepresentation, or concealment in order to gain something of value. CMS further clarifies fraud as intentionally submitting false information to the government or a government contractor in order to get money or a benefit. Examples of fraud: knowingly billing for services that were never rendered, knowingly billing for services at a higher rate than is actually justified, accepting bribes. Waste is defined as overutilization of services, not caused by criminally negligent actions, and the misuse of resources. In context of CMS, waste is overutilization of services or other practices that directly or indirectly result in unnecessary cost to the Medicare program. Examples of waste: unnecessary wastage of medical supplies like cotton, syringes, medical solutions. Inaccurate claims data submission resulting in unnecessary rebilling or claims. Abuse is defined as excessive or improper use of services or actions that are inconsistent with acceptable business or medical practice. Abuse refers to incidents that, although not fraudulent, may directly or indirectly cause financial loss. CMS includes actions that may, directly or indirectly, result in unnecessary costs to the Medicare program. Examples of abuse: providing medically unnecessary services, misrepresenting services resulting in unnecessary cost to the Medicare program, improper payments to providers or overpayments. How is fraud, which is a criminal act, differentiated from waste and abuse? Fraud. The intention to deceive is high. Despite knowledge that an act is illegal, it is still committed. Take identity theft, for example. Stealing and using someone else's identity is illegal, yet it is done. Waste. The intention to deceive is very low. Overuse, underuse, and ineffective use of services is an example of waste. Abuse. The intention to deceive is in the middle of the spectrum. Requesting an MRI for a 2-day shoulder pain complaint is an example. It is not required to make a diagnosis and would result in a financial loss for Medicare once reimbursed. Who could be involved in Medicare or Medicaid fraud, waste, and abuse? Anyone with a motive, means, and opportunity can commit fraud, waste, and abuse. Some examples are physicians, nurses, and other healthcare providers, patients or beneficiaries, plan sponsors, insurance agents or brokers, hospitals, home health agencies, laboratories, drug manufacturers, health plans, pharmacies, durable medical equipment, DME providers, pharmacy benefits managers, PBMs, criminal syndicates, anyone who bills Medicare or Medicaid. Let's look at some of the fraudsters whom the Office of the Inspector General, along with the CMS, FBI, and other government agencies, has placed behind bars. The crime. Joseph Caramadre committed fraud by obtaining identity information of terminal patients and purchasing variable annuities and put bonds in their names. Estimated loss, $15 million. The crime. David Kwiatkowski, health worker, stole syringes of the controlled substance fentanyl and injected them into himself to treat his hepatitis C. He then refilled the syringes with saline for use with unsuspecting patients. Result: this action caused an outbreak of hepatitis C. The crime. Nashville Pharmacy Services, LLC, and owner, Kevin Hartman, overbilled Medicare and TennCare for pharmacy services, dispensing HIV and AIDS-related medications. Estimated loss, $7.8 million. The crime. Dr. Farid Fatah, hematologist and oncologist, misdiagnosed cancer, then prescribed expensive intravenous therapies, medications, and diagnostic tests for these patients. Estimated loss, $17 million. The crime. Global Healthcare GlaxoSmithKline introduced misbranded drugs, Paxil and Wellbutrin, into the marketplace and failed to report that the U.S. FDA has not approved the use of the depression drug Avandia on minors. Result: fined $3 billion. Let's take a quiz to review what you've learned. Let's take a quiz